I think the title, thank you. My name's Cathy Farrell. I'm a heart failure nurse in Donegal, working at the moment in the community care, but I've worked in Letterkenny Hospital for almost 20 years before that. And I'm delighted to be asked to talk. The title is Cardiac Care in Donegal, but actually it's a little bit more about the nursing care, symptom management, and what us heart failures do to help support living with cardiac amyloidosis. So, as I said, an overview is really to look at the common symptoms and complications. Heart failure is my area of working, it's my area of interest, but we'll have a look at the gastrointestinal and the neuropathy side of it as well. Limited knowledge, there's definitely more experts in the room on that side than me. Look a little bit about the patient education and some of the self-management and supportive care at home, and then briefly an overview of the Donegal service. So I'm not going to go through the ATTR amyloid, that's why we're here, but it is that interruption of proteins that cause all these symptoms systemically throughout the body. We concentrate from the heart, from a heart failure nurse point of view, but obviously, as we've heard already, it can affect all parts of the body. So the clinical presentation, as Paul so eloquently told us, is often heart failure. When it infiltrates in the heart, it causes impaired relaxation, stiffness of that heart muscle that then leads to volume overload, and clinically it's heart failure, which I always say the words heart failure would give you heart failure. That's nearly a worse one to Google, Paul, than amyloidosis. But it is the disease, it is what it's called. And it's learning to recognise the signs of fluid overload. So shortness of breath when you're walking, needing to stop, where you could before climb the stairs, now you're stopping halfway up. That lying down at night is a big red flag, you know, people waking up breathless, and then they feel fine during the day. So they think, well, okay now, bad night. Or the family say they're panicking, they're very anxious at night, but it's this fluid in the lungs making them feel like they're drowning when they're lying down. So that's a real red flag that we want people to know about, to seek help that day. Don't be, just because you feel okay during the day, don't wait. Peripheral edema, I do say when you've got swollen ankles, you can see it and then it's easy. It's not as easy to see when you've got fluid in the tummy and feeling bloated. The orthostatic hypertension, big words like jam, I say, get feeling dizzy standing up. You know, when people find they have low blood pressure, stand up quickly, just feel dizzy, may fall over, cause all sorts of problems. And then fainting is when we've got conduction disease in the heart. We can have, that's why you heard Mary say so many of them have pacemakers. The conduction disease causes the heart rate to go too slow, and very often people come into hospital with a collapse or a faint, and then we find other problems that leads to their diagnosis. The peripheral neuropathy is really, you will be more aware than me, but that numbness or pain in the feet, and to say it's not always pain. Sometimes a very light touch, sheets on the bed, can cause a lot of pain. You know, it's not always have a feeling that you have to knock it or have a hard press on it. And then balance problems from just not feeling your feet as well, not being aware of your foot position can cause falling over. In the gut, again, with the amyloid in it, can reduce the stomach emptying, so you can feel full very easily, so it's not able to eat or feeling sick. Lots of people have problems with diarrhea and vomiting, and they can be very difficult to manage and getting out of the house. Feeling bloated, and as Mary said earlier, weight loss. You know, a lot of people don't get, the food isn't absorbed as well as it should be, and then you find that there is a lot of unintentional weight loss quite quickly. So when we look at heart failure strategies, that's our bread and butter. So water tablets are great tablets till they're not, you know, so they're really good at getting rid of extra fluid when you need them. But if you have too much, it can lead to low blood pressure, it can lead to dehydration, kidney problems. So it's trying to learn how to balance that. And as heart failure nurses, we do a lot of work at trying to teach you how to know when you need extra water tablets. And I always say, of all the tablets we try and get more into you, water tablets, it's as little as you need, but teaching you how to know at home if you need extra and how to report early. Looking at the other cardiac therapies, you know, blood pressure tablets can swing. People can have amyloidosis and high blood pressure. They also can have amyloidosis and low blood pressure. So it's kind of just making sure that you have enough medication and not too much medication, so de-prescribing the stuff that you need. Salt and fluid restriction if you need it. Some people do need a little bit extra salt. Some people need to have very little salt. So it is individual, and it is working with your heart failure nurse and doctor to find out whether you need to have a restriction or not. And then self-monitoring. So all of this is about knowing what's normal for you, knowing what your good days are like, and then detecting early. So weight management is a big part of it, not for body weight, but for changes in weight. So if you gain weight quite quickly, it's a really good sign of fluid retention that you mightn't actually feel symptoms. Some people have half a stone on before they actually start to feel symptoms of fluid overload. So managing low blood pressure is one of the most difficult, and I'm not very good at it. I don't know about everybody else in the room. It can be very difficult to manage low blood pressure, trying to make sure that you have slow changes, that, you know, not jumping out of bed to go to the bathroom, or if the doorbell rings, it's okay not to rush to it. Taking your time getting up. Some people find compression stockings help, and then there are some medication that can be prescribed if needed. From the stomach point of view, it's trying to eat smaller meals regularly if you feel that you're very full. If sickness is difficult, it's trying to prioritise protein food, you know, so that you're getting your nutrients. Low-fat diet, if there's a lot of fat in the stool. Some medication for diarrhoea or stool softeners for constipation can be useful and needed. And then if needed, then we need to look at the supplementation of the diet or referral to dietitian for Ensure or similar drinks if you're not getting nutrition through food. So the sensory loss, have we heard, is, you know, it's very difficult to manage, just trying to treat the cause of neuropathy rather than the symptoms. Fall prevention strategies, so making sure that there's good shoes, good lighting, don't clutter the hallways, you know, that people aren't falling over if they're not feeling their feet as much. If people have diabetes, it's trying to make sure that the blood sugar is well controlled, and then avoid like alcohol or toxins that can cause neuropathy on their own. So just good diet and exercise. So from a nursing point of view, it's really about the medication adherence, so understanding what the tablets are for, what potential side effects are, de-prescribing, as I said, tablets that you don't need anymore, so it's trying to get that balance. We do regular reviews of the cardiovascular vital signs, so checking blood pressures, ECG monitorings for that electric conduction problems. Teaching people and working with them to recognise red flags, so signs of fluid building up so that we can intervene early. If you're feeling more dizzy, making sure 24-hour blood pressure monitors are if we need them. And then liaising with the medical staff if need be for changes in therapies or onward referral or assessment. The nutritional counselling and onward referral to dietitian then is an important part of our work as well. So in terms of Donegal, I'm a wee bit like Sinead. I think we are all one province, and it's a shame to have such different services. We had Fadimus right from the beginning. Dr. David was a prescriber from the early access, and it was shocking a few years later to hear it wasn't available this side of the border. But we have a relatively good service. I think there's a lot of amyloidosis in Donegal like there is in Derry. We were aware of it, and initially it was like, well, there is no treatment. It was nearly taking away treatments and treat the heart failure. So it's actually a really good time to be a heart failure nurse in Donegal, because there's a lot more proactive treatment these days. So in terms of diagnosis, patients can be referred to the cardiologist in the hospital for assessment if there's a suspicion or they're worried about amyloidosis. If they have symptoms of heart failure, they can be referred to the community cardiology team. We screen them as well for heart failure. And then the initial assessment, so the physical assessment, history, echo, can all be done in Donegal. The blood test, initially to exclude AL, is the most important ones done locally, and then referred for a DPT scan in the Mater. Now, if that's positive, then we do the genetic tests when we've had the DPT scan, and initial assessments like Practitioner or Fadimus can be started locally, but patients will be referred then to Dublin to either Tala or the Mater for assessment for neuropathy and for additional therapies up there. And we do a lot of liaison with the team in the Mater. I'm very grateful for them, because if we have patients that we're worried about, they will see quite quickly. And then we do ongoing monitoring, Holter monitors or echoes, blood tests done locally, and liaise with Professor Joyce and Dr. Giblin and the teams in the matter. So, as we're all hearing, the early recognition is vital. Our nursing care is on symptom relief, monitoring, supporting education. The multidisciplinary team is vital, and we're all raising awareness through the meeting like today. Thank you.